Have you ever wondered what supplements might improve your erections and libido for real? I'm Dr. Riva, urologist and pelvic surgeon, and welcome back to the Riva Labby MD podcast, your trusted guide for leveling up your health, sex life, and relationships with evidence-based tools. You are hearing the first half of this episode. If you want to listen to the full episode, please consider joining our membership, where you can have full access to the entire monthly AMA, as well as early access to our transcripts and the option to ask questions on the membership itself. And without further ado, let's get to it. I have listened to a few of your videos regarding supplements that are supposed to help with stronger erections. Can you tell me which supplements for stronger erection supplements or herbs that are scientifically proven to increase blood flow, increase semen volume, stronger erections for older men, and increase libido for men, let's say over 60? All right? So there's lots of supplements out there, and a lot of them are really marketed quite well. Now, the ones that work or have the most evidence behind them, I will tell you about those. But before I do that, I want to tell you that there is a big thing with supplements that many people don't realize, especially with sexual function. When you look at data on sexual function medications, when I give you a placebo pill and I say, hey, here's a sugar pill, it's going to improve your erections. 40% of the time, it's going to improve your erections. That's called the placebo effect. So a lot of times when people talk about how their life dramatically changed because of a supplement, they may be experiencing the placebo effect. And that's exactly why we do studies. We do randomized controlled trials to compare people taking a medication to people taking a placebo and see if there's a real significant difference. Now, in terms of stronger erections, you asked about stronger erections, more semen volume, and more libido. So let's start with erections. For stronger erections, the supplements that I find work the best and have the most abundant data, the one is l'arginine. Now, l'arginine is a amino acid that is a precursor for nitric oxide. So when I give you l'arginine, your body converts it to nitric oxide. And nitric oxide is an ignition for erections. Essentially, you need nitric oxide around for your body to start the cascade of events that cause relaxation of the blood vessels for blood to flow in, and for you to get that strong, firm erection. Now, nitric oxide is released when you see something, hear something, feel something, or even smell something that you think is desirable or causes arousal. And then nitric oxide is released from blood vessels and nerves. And so more nitric oxide would mean that, yes, you would essentially have more stronger erections or more stronger blood flow. So in the data, L-arginine, which is taken 3 times a day, has been studied in a multitude of studies and has shown some benefit. However, L-arginine is not very bioavailable, which is the reason I don't actually recommend it quite often, because it breaks down really quickly. You need to take it 3 times a day. Now, L-citrulline, which converts to l'arginine, is more bioavailable. And although there's not as much robust data, it's a lot easier to sort of adhere to taking a supplement twice a day. So typically, I'll recommend 1,500 milligrams of L-citrulline daily. But here's the caveat. If you have really severe erectile dysfunction, this may not do anything for you. All the studies done on supplements are typically done on young, healthy men who don't have a lot of medical problems, with some rare exceptions. So generally speaking, what I tell people is if you have mild to moderate erectile dysfunction, this might help you. It might make you respond a little bit better if you have moderate ED to medications like tadalafil or sildenafil, which are Cialis and Viagra, but it's not going to magically transform you to fix all your erections. So that's for erections. Now, in terms of semen volume, there's actually no really strong evidence. And in fact, I have a video coming out on this. There's not a strong evidence on any supplements when it comes to specifically semen volume. All this marketing and ingredients that you see promoted for semen volume are pretty much looked at for sperm parameters. When they look at sperm parameters, they're assuming that when you get more sperm, you're going to get more semen volume. And that's not exactly true, because sperm only really make up about 5 to 10% of the entire semen volume. So, necessarily taking a supplement that improves your sperm health doesn't necessarily translate to semen volume. So, generally, I don't actually recommend a supplement for this purpose. What I do recommend is that you drink more fluids. So, hydration will increase semen volume. I also recommend that if you want to have a larger load, for lack of a better terminology, you want to abstain from sex for 2 to 3 days before having that ejaculate. And you will see that the volume is larger. Now, these are natural ways to improve the volume. Now, some people swear by things like celery. Now, I would say that celery is a vegetable that's made up of a lot of water. So, essentially, when you're eating a lot of celery, you're getting a lot of hydration as well. Those are probably the most valuable things you can do. And also check out your medications. Certain medications can cause side effects like retrograde ejaculation, which means that when you ejaculate, some of the semen actually goes back into the bladder rather than coming out of the urethra. And stopping those medications essentially fixes the problem. The other thing is, if you're diabetic, this can also cause retrograde ejaculation. And so fixing your either preventing diabetes in the first place, or if you are diabetic, improving your sugar control can also help in this area. Now, lastly, you asked about libido. Now, with libido is very complex, right? Having desire for sex is complicated. There's also psychological components and a variety of different things, but most often people are talking about testosterone and testosterone boosting. So, when I look at the abundance of data on testosterone boosting supplements, a lot of them really don't have a ton of data. And even if you look at the supplements that have the best data, it's not really that remarkable. Now, the one that seems to have good data is called Tonnet Ali. It is a herbal supplement that has been shown to improve some degree of testosterone in a few studies. And so it consistently shown that out of all the supplements that I've reviewed in my lifetime through reading the research, I would say that has probably the best research. But again, I go back to saying do the things first that are natural. And this includes getting good sleep. The large majority of people are not getting good sleep. And when you have less than 5 hours of sleep a night, you're reducing your testosterone by 15%, also improving your diet. So, including sort of a Mediterranean style diet with lots of vegetables and fruit and eating lean meats and proteins, healthy fats, all of that can improve your testosterone. Resistance training of the very large muscle groups, so lower body, doing deadlifts, squats, those sorts of exercises are actually shown to improve testosterone and reducing stress. Stress is one that we don't talk about enough, but honestly, it affects every part of sexual function, including erectile function and libido. So, reducing stress as best as possible. And lastly, avoiding endocrine disrupting chemicals like plastics in the environment. So, making sure your water bottles are not in plastic. Making sure you're not heating up food in plastic or storing food in plastic can make a big difference in terms of your exposure to these sorts of compounds that can reduce testosterone. My surgeon has me scheduled for a prostatectomy. I've been reading about leakage after prostate surgery. How common is this? Leakage after prostate surgery. When you think about male anatomy, there are two sphincters that control urine. One is where the prostate sits, and one is below that. And so when we remove the prostate, we're actually sort of removing one of the sphincters that keeps urine in. And so it makes it more easy that you can leak. Specifically with coughing, sneezing, lifting, bending over. This is called stress urinary incontinence. Typically, men don't suffer from this unless they either have a prostate removal or injury to one of these sphincters. This happens to most guys immediately after surgery. Now, typically, it gets better pretty quickly. In about 15% of guys, they have persistent leakage after prostatectomy where they continue to have this leakage. Now, that doesn't mean that it's always very severe leakage, but it's enough. Bothersome, or that it's enough that they may need to use an absorbent pad in their underwear. How do you fix this problem? One is doing Kegel exercises. So, We've talked about that on this channel, on this podcast before, but Kegel exercises are essentially when you're strengthening the pelvic floor muscles so that they can hold urine in better. And so this is best done with a pelvic floor physical therapist, especially for guys where it's very difficult because you've never even thought about those muscles in your life ever before. But if you want to do them at home, let me just go over it briefly. There's two ways I like to think about it. One is you can practice doing it when you urinate. So, when you urinate, you can stop the stream of urine. That actually activates your pelvic floor muscles. That's fine to learn it, but I don't want you to be doing it all the time when you're peeing because that can create a dysfunction or a problem. So, it's just really to learn where the muscles are and how to use them. The other thing is you can use a cue like you are lifting up your penis without touching it. That can be a good cue to help you understand that you are squeezing those pelvic floor muscles and then relaxing. And the last cue, sometimes they'll be like holding in a fart. And those are can help you sort of squeeze those muscles. You want to be careful not to squeeze your belly or squeeze your bottom. But again, doing this with a pelvic floor physical therapist is probably the most beneficial. After that, there are a couple surgeries available. There is a male sling, which is essentially like a hammock that is placed underneath the urethra to hold it up and prevent leakage. That's good for mild to moderate incontinence, meaning it's not very severe and you have not had radiation. And the last option that's widely available is an artificial urinary sphincter. That's where we actually implant a cuff that goes around the urethra, and then you have a button in your scrotum that you press when you want to open it, and it allows you to urinate. This is a very good operation, but it's an implanted device, so you have to talk to your surgeon about the risks. Now, if you don't want any of those things, obviously you can use absorbent pads. You can use constriction type devices on the penis like cuffs or bands that actually keep the urethra closed. And then when you want to urinate, you open those up. They can be very helpful, and then a variety of different things to sort of manage urine leakage. If you are in that situation, you don't want to have anything else further. The other thing that I think we don't talk about enough is that sometimes people leak when they orgasm. And this is again for the same reason. There's not that blockage of a sphincter to help urine stay in. And this is a much more challenging issue. But I bring it up because if you're struggling with it, please talk to your doctor because we can try and help you with those issues. But if you don't talk about it, then we don't know what's happening. And not every doctor will bring it up to ask you about it. So make sure you bring it up yourself and talk about it. I'm 50 and I've had 4 UTI in the last year. I'm not having sex as often recurrent UTIs because I'm assuming that'll make my UTI happen. My mom had something similar happen to her and she kept having repeat UTI too. And it was a pain in the butt because we always had to take her to the hospital for repeat UTI. I don't want to end up like her. Where do I start to fix this? I'm not trying to become one of those old ladies who always pees on herself. Okay, great question. So, let's first start off by UTI and recurrent UTI. So, urinary tract infection is essentially an infection of the bladder or the urinary tract. It is often accompanied by pain with urination, a pain in the bladder area. Sometimes it can even be pain in the lower back or the flank area. And these are all symptoms and signs of having a urinary tract infection, and sometimes there is bleeding as well. Now, differentiating a UTI always have symptoms versus asymptomatic bacteria. So oftentimes people will get diagnosed with UTI because it shows up on a urine test, but they have no symptoms at all. And this is actually quite common in elderly patients. And so I'd say if you have no symptoms at all, I don't want you to worry. I want you to not take antibiotics because taking antibiotics over and over again for asymptomatic symptoms actually causes more harm than good because you become resistant to those antibiotics, and that becomes a problem later on in life. Now, in this particular person, she didn't say whether she was having symptoms or not, but let's assume she is. If you're having more than 2 UTI, symptomatic UTI that have been shown on a urine culture, meaning your doctor sent it for a culture, and it came back with a bacteria that was positive 2 in 6 months or 3 in a year, means you're having recurrent urinary tract infections. So, what can you do about it? First and foremost, hydration. You want to make sure you're drinking 2 to 3 liters of water or fluid a day. You want to make sure you're hydrating well. Your urine should look like lemonade, light yellow urine. Oftentimes, we'll find that people have UTI after when they travel more often because they're dehydrated, right? So make sure you're hydrating well. Number two, treat your constipation. So many people don't realize that constipation and bladder issues go hand in hand. So when you're constipated, it fills up the rectum and it pushes against your bladder. This puts you at higher risk for a lot of things like urinary symptoms, but also for UTI. So you want to make sure that you are having a soft, easy bowel movement every time you have a bowel movement, that you're not pushing or straining or having any hard pellets. Check out the Bristol stool scale. You should be in the middle of that stool scale. You don't want hard pellets and you don't want it to be super loose. And if you're struggling with that, talk to your primary care doctor. Make sure you are improving your bowel movements. Now, the next thing, if you are 50, meaning you are around the time of menopause, or you are lactating like you've given birth, and you are now breastfeeding your child, this actually puts you at risk for UTI as well, because when you're thinking about the vaginal microbiome, it is influenced by estrogen. There are estrogen receptors in the vagina, which then sort of take the estrogen that you give. Essentially, through a process, they increase lactobacilli and keep your vagina in acidic pH, so they keep it acidic. And that helps prevent UTI. When you lose estrogen, your pH becomes more basic, which basically means that you can no longer sort of fight these bacteria effectively. So using vaginal estrogen cream is so effective in preventing UTI. It's very easy. You can use it in a cream, a suppository, or even a ring. But I like the cream because it's just very easy to use. You fill your finger with it, put a bunch of vaginal estrogen on your finger, and rub it in like lotion. Throw away the applicator. It's annoying. It's messy. You just rub it into the vaginal tissue twice a week at night. There is no risk of cancer. There's no risk of blood clot or stroke. The topical estrogen is very safe and very distinct from systemic estrogen that you take for menopause therapy. Now, when you're talking about vagin, there are some slight risks. Sometimes there's breast tenderness with the vaginal estrogen, and usually that goes away with time. Another thing that works quite well is cranberry supplements. So, cranberry supplements with 36 milligrams of proanthocyanidins or 100% cranberry juice taken daily can help prevent recurrent UTI. So, another thing you can try, make sure you're getting a 36 milligram proanthocyanate supplement that is including the fruit of the berry, not the skin and the stem. So avoid whole berry products. You want to make sure they are actually taking the proanthocyanins from inside the berry, and you want to make sure it's soluble. So do your research, get a very high quality supplement. The other ones will not work. Lastly, if you've tried all bottom line these things, you want to make sure you're emptying your bladder. What often happens is people don't completely empty their bladder. That urine sits in the bladder and it creates food for bacteria. So when you go to the bathroom, make sure you're going twice. So sit down, relax, empty your bladder. And for guys, if you're standing, empty your bladder, walk away, walk around in a circle, sit back down, and pee again. Try to empty your bladder completely. And if you're still worried, make sure to see a urologist to get evaluated to see that indeed, yes, you are emptying your bladder completely and there's nothing else going on. If you guys want to hear the rest of this Ask Me Anything, make sure to subscribe to the Supercast at riemalik.supcast.com. And as always, we're going to take care of yourself because you're worth